Yeah. So yeah, I'll share my screen again. So yes, welcome to the course, all of you. So what do we expect from you in this course? It's just about um, these two learning outcomes. So we would expect you to understand the policy context, sorry, of healthcare services. Okay, so the policy, we're talking about policy here. That means there'll be legislation, there'll be guidelines, and these are there just to support you. Okay, so if you know the policy, it helps you and keeps you and the others safe as well. So here we would want to identify the legislation, policy, and guidelines that impact on the healthcare delivery. Okay, there's some policies, there's legislations and guidelines that that make the healthcare delivery work. So what are those? We'll talk a bit about them. And then in the same learning outcome, under the same learning outcome, you would want to describe the impact of key requirements on services. So when you're delivering services, what are the important requirements that you need to cover? Those are of like those cannot be missed out. Okay. So that's your first learning outcome that we will be discussing today. And the second learning outcome is to understand the requirements necessary for working as a healthcare professional. So here you would identify two of the requirements that are necessary for a healthcare professional, and these are in terms of values, attitudes, skills, knowledge, ethics. Okay, so the session that we will cover tomorrow, the learning outcome that we will cover tomorrow, will be based on the values, attitudes, skills, knowledge, and ethics of within healthcare professionalism. And we would also compare and contrast the merits of each of these. Okay, so we are comparing and contrasting what's the difference between them. What does value mean? What does attitude mean in healthcare professionalism? And the second part of this second learning outcome is to describe the importance of reflective practice. So anyone out there, do you know what reflective practice is? What do we mean by reflective practice? Anyone? What is a reflection? In a mirror, when you see yourself, uh, what is it? What is a reflection? So a reflection, like when you have the mirror in front of you, you can always write it in the chat box if you're not comfortable turning off your mic. I understand. I have children, but I'm in a secret room, so they're not allowed to enter the room. But sometimes it's hard. Sometimes it's hard for me also, and um, I understand your situation as well because it's obviously there's family around. Um, so you can always use the chat box here. Okay, so you can just click on it and then write your answer here. So reflection is what you've done already. So you see what you have done or you see the process. So for instance, if I have taught you today this learning outcome, the first learning outcome, I will then go back and reflect. It's good practice. It's the best practice actually. I'll go back and I'll reflect and I'll start writing down. You might not want to write down. You just think about it. What did you do right? Where did you go wrong? And how could you do it better? So that is a whole reflective practice that you should have in yourself. And that is admitting your um, your strengths and your weaknesses and how to overcome those weaknesses and how to build upon those strengths. Okay, so it's for your best practice. Okay, if you're being patient centered, you need best practice. Okay, so that's about it. So a bit about the structure of of this unit. So today I'll just open up my calendar in front of you. So we have today is the 8th of February. So what we intend to do is that we intend to cover the second learning outcome on tomorrow, which is the 9th of February. So that covers your course, okay? But we will have an assignment discussion on the 15th of February, God willing. And this means that whenever we have our assignment discussion, that wraps up the course, and then you're expected to submit your assignment 2 weeks from the day we discuss our assignment. So if they're discussing the assignment on the 15th of February, you will be expected to submit your assignment on the 1st of March. Okay. So if you have other documents that if other assignments that you're focusing on, or you need more time, please let us know. So I'll share with you the link or the email that you need to use for your submissions of your assignments, and also for any questions or any queries that you have. So these recordings will be available on Monday. So we will be sending across the recordings on Monday. Please check your Moodle pages. Um, so I'll just start sharing my screen for the first learning outcome. Just bear with me a moment. So I hope my screen is visible to you. So, and my voice is also audible. So please let me know if you have any questions in between. Um, I always love it to be an interactive session where you speak and I speak together, and we, because your experience cannot be matched by my experience, and my experience cannot be matched by your experience. I am completely into teaching, so I don't know what happens out in the workspace when you're working with, as I said to one of the students, that working in a psychiatric ward, because I have a love for psychiatry. um, I'm not really sure I just teach it and I don't know how you work in it. So it's something that amazes me, that how do you do it? Even though I'm a doctor, but I've not worked with psychiatric patients. I've taught about them, but yeah, because I've come into academia. So yeah, just share your experiences, or if you have anything more to add to. And along the way, if you have some more suggestions, please let me know. So we have it not just a one-way lecture where just I'm speaking and you're listening or making notes, and it's just two-way, which is helpful for all of us. Yeah, so we're talking about the policy context of healthcare services. This is the introduction, the first learning outcome for the introduction to professional healthcare service and practice. So, a bit about what policy and legislation are. So, policy, we know that it's a set of guidelines. Okay, so we are given guidelines according to which we would have to work, and we have our actions would be guided by these policies. So, anything uh, uh, like away from these policies, anything that is not a part of the policy, um, you should not worry about it, but if it's in the policy, you should make sure that you know what it is. And this is again, if you know about it, it helps you in the longer run, and it helps support your patients and your work as well. So what is policy and legislation that impacts healthcare? Let's take an example of the policy context of healthcare and how does it impact healthcare delivery. So a lot of the healthcare within the UK, it's delivered by or on behalf of the National Health Services, NHS. Okay, so it is their policies. So the NHS has policies that cover everything that is over here, that is delivered over here, um, with regards to healthcare. Um, so it's their policies that would be dominating the healthcare provision. There's a whole range of policies, legislations, and guidelines. So it is for everyday healthcare situations. So if you're stuck in some place and you need support on it, always go back to the policies, legislations, and guidelines and follow them. And they have been made in such a way that they're not hard to understand for people of any language. By that I mean that if you're not if English is not your first language, that doesn't matter. But if you know some bits of it, you would be okay. Um, so when you look at these support you in your education and your training and supporting your patients as well. Okay, so so we are concerned here what when we talk about policy and legislation. They're the overarching requirements that provide the context in which day-to-day healthcare is provided. Okay, so there are a lot of requirements with everyday healthcare situations, so we need to know those. So much of this policy, it's relevant to the whole of the UK, but there are some differences. So there are variations between England, Scotland, Northern Ireland, and Wales. So we're focusing more on England. Okay. You should also be aware, however, of of policy updates and access up-to-date knowledge, and that is a part of your course and of your career. So it's continuous professional development, your CPD, that you need to um, stay, be aware of what policy changes um, that are happening in the UK, especially. So, what are the key organizations that make up the NHS, and how can they collaborate with partners in health and care, uh, health and care system to deliver joined up care? So, or combined care. So, what I'll do is that I'll just share this this link with you. Please have a look at it once we're done with this lecture, so that you know what are the health and social care standards that we're talking about. I'm sharing this link in the chat box over here. Just have a look at it. And yeah, and we can discuss this in detail tomorrow. Please access this, all of you. This chat box is open here. So please click on this link. Just save it, because at the end of this meeting, this chat box will close and then you won't have access to the link. So please just save it at your end. So this talks about the because we are multicultural and we have so many people coming with so many um, diff very it varies. So whatever people are coming up with, or whatever healthcare concerns there are, they all vary. So not you won't have two people of this with the same concerns or the same um, background. So if there's different backgrounds, there'll be different health conditions, different concerns that they come with, and how does the NHS deal with it? This is all about um, this video is all about that. So just have a look at it. If you have any questions, please let me know. So policy and legislation, how does it impact your uh, impact on healthcare? So you have the UK government. So this is a hierarchy or the structure of the healthcare and social care system in the UK. Okay, so we have the UK government, within which we have the UK Treasury. So there's Department of Health and Social Care, under which you have NHS England. Then you have Northern Ireland Assembly. So this is for England. So you have the Department of Health and Social Care, and that works for the NHS England, and the NHS works for Department of Health and Social Care. Now coming towards, so that it is all support, all of these areas they are supported by the UK Treasury. Okay, so then we have Northern Ireland Assembly. Within which you have the Northern Ireland Executive, and you have the Department of Health, Social Services and Public Safety. Okay, so you don't have the NHS England obviously working there. Then you have the National Assembly for Wales, which you have the Welsh government, within which you have the Department of Health and Social Services that are responsible for the health of the area. And then the last is the Scottish Parliament, within which you have Scottish Executive, and within which you have the Directorate for Health and Social Care, working for health and social care system. Okay, so the major policies that you need to be aware of are in relation to the delivery of the devolution of healthcare. So how is healthcare being divided? So what is under what domain does healthcare come? So for instance, within the NHS England, it is the Department of Health and Social Care. Within Northern Ireland, you have the Northern Ireland Assembly. So this is what it means. How is it devolved? What roles are played by which type of organization? The integration of health and social care. Okay, so how is it integrated? What departments are integrated within the health and social care? And the principle of choice of healthcare. So these are the major policies that you need to look for in relation to the delivery of healthcare within the United Kingdom. Okay. Um, so there's legislation that affects the delivery of healthcare, which includes Health and Safety at Work Act, which was founded in 1974, and other health and safety legislations. You have the Mental Health Act 1983, which was revised in 2007. You have the Human Rights Act in 1998, data protection legislation, and you have the regulations 1998 revised in 2016, Mental Capacity Act 2005, Health and Social Care Act 2008 that has regulated activities, and regulations in 2014. So these are also related to health and social care. Equality Act 2010, Health and Social Care Act 2012, and Care Act 2014. So you have if you have the most updated versions, those will help you and support you in your day-to-day activities, within the health and social care setup. So a bit about what happens in England. So so in England, the Secretary of State for Health will have the overall responsibility for public health, the NHS, and the social care so it's the Secretary of Health, Secretary for State of Health. Okay, so that's how that they bear the responsibility for the public health, the NHS, and the social care within England. So the Department of Health and Social Care, what is it responsible for? It is responsible for funding of health and social care in England. So the department provides the NHS a set of objectives, and these will include improving healthcare and using the budget efficiently. So they have two main objectives: improvement of healthcare, and whatever budget there is allocated to them, they use it efficiently. England is an independent body. So it is independent of the government, and it sets priority for the NHS in order to improve health and care. Okay, so and there's certain set of objectives that are set by the government. They're working with CCGs, which are clinical commissioning groups. This is about NHS England I'm mentioning. They produce a business plan to show how they meet their objectives. Okay, so you can have a look at their business plans over here. That is to meet their objectives. The CCGs, the clinical commissioning groups, they receive a budget from the government for secondary services. So these will include acute hospital care, rehabilitation care, emergency care, including the NHS 111, community health services, and mental health services. So CCGs are also produce business plans, and these are to show how they will meet their objectives. So you have the NHS England, that is there, and it has certain goals. It works with CCGs. So monitoring and regulation of the NHS, how is it carried out? It's by the Health Watch and the Care Quality Commission, CQC. Okay, so they have their rounds on a regular basis, and they see what is going well, what is not going well, and they make recommendations according to it. Then you have the guidelines on health and social care issues, and that are developed by the NICE guidelines. So you have the National Institute for Health and Care Excellence that produces guidelines on health and care issues. And then you have the Health Education England, HEE, that is responsible for education and training of the NHS workforce. So this is all about the NHS within England. I hope that's clear. If there are any questions, please let me know. So now coming towards Northern Ireland. Okay, so I'll go back. So here we had talked about Northern Ireland. So the Department of Health and Social Care was responsible for the NHS England. We've talked about that. Now we have the Northern Ireland Assembly, within which you have the Northern Ireland Executive, and that delivers services, and that works upon the Department of Health and Social Services and Public Safety. So the health and social care, they're brought under one administrative system managed by the DOH, or Department of Health, Social Services and Public Safety. So what do they do? What responsibilities do they have within the Northern Ireland? They are responsible for Health and Social Care Board, which has an overall commissioning responsibility. They have 5 local commissioning boards that are responsible for buying local services. They have 5 health and social care trusts, and these provide health and social care in their areas, plus the ambulance services that operate on a national level. They have a patient and client council that you've not heard over here, and that's through which patients and communities can influence healthcare. So there's a council just for patient and clients. The Regulation of Quality Improvement Authority, which monitors the NHS, and the Public Health Agency, which is responsible for improving the general health of the public. Okay, that's about Northern Ireland. Now, coming towards Wales, we had talked about the National Assembly of Wales, and within that you have the Welsh government, within which you have the Department of Health and Social Services. Okay, so the Welsh government has an overall control, as we just saw. And what are their responsibilities? So they have 7 local health boards, and these are responsible for planning, commissioning, and delivering healthcare in their geographical areas. They have 3 national trusts. So you have the ambulance service, a specialist cancer support trust, and the public health body. And you have 7 community health councils that look at general health and well-being in their areas. Okay, so these are the main 3 functions of the Welsh government, and how they control them. Talking about Scotland, so this is the last bit. So the Scottish government, it has national objectives and priorities, and these are delivered through 14 NHS boards, which plan, commission, and deliver healthcare in their areas. They have 7 special boards that provide national services. And they have the Health Improvement Board, and this is there to monitor services and outcomes. Okay, so we've talked about England, we've talked about Northern Ireland, we've talked about Wales, and we've talked about the Scottish executive, the Scottish healthcare system. Now, identifying the legislation, policy, and guidelines that impact on healthcare delivery. Now that we know that how it is delivered, through which structures, we'll talk about the impact on healthcare delivery. So the key principles of legislation, policies, and guidelines, there's some of them that we will discuss here. So we've talked a bit about them. We'll talk about a bit more detail. So you have the NHS, the National Health Service Act, 1946. So this act established the NHS itself, and it is publicly funded by the healthcare system in the UK. And it sets out the principles of the NHS. So the principles of NHS come from the National Health Services Act, and they're there to outline how the funding is done and how is it managed. Okay, so you have the National Health Services Act 1946. Then you have the NHS Constitution. So this is a document that sets out the values, principles, and rights. Those are there to underpin the NHS in England. It outlines the rights and responsibilities of staff, patients, and public. Okay, so all your rights, all your values, all your principles are in the NHS Constitution. And then we have the CARE Act 2014. So this is a legislation, part of the legislation, and it provides a legal framework for protection and support of adults at risk of abuse or neglect. So it is mainly for identifying abuse and neglect and within the local authorities and other organizations. Okay, so the CARE Act 2014 is very important as well. You have the GDPR, where your personal data is collected, used, and stored. Okay, so it's according to the EU regulations. It applies to all organizations, and it is there for personal data, including that of the healthcare providers. And then you have the NICE guidelines, and these are updated on a regular basis. And they're there for prevention, diagnosis, and treatment of several medical conditions. And they are there to be used by healthcare professionals to improve their quality or to provide high quality care to their patients. Health and Safety at Work Act 1974. So this act, it sets out the responsibilities of employers. So this is for employers, not for employees. This is for employers that to ensure the health and safety of their employees. It applies to all workplaces, including healthcare settings. And then you have the Mental Health Act 1983. So this legislation will provide a framework for treatment and care of people who have mental health conditions. All the circumstances under which a person can be detained and treated involuntarily can also be found in the Mental Health Act 1983. Okay. Now we go on to describe. So this is our last slide for today. So this is our second part of our first learning outcome. So we are describing the impact of key requirements on services. So three impacts: effectiveness, experience, and safety. Any questions so far? I'll just quickly take your attendance because I'm realizing that there's one more person who's just joined in. Just bear with me a moment. Just a minute. Yeah, I'm just done. Sorry for that. Okay. So, yeah, if there are no questions, we'll proceed with our slides. Yeah, your attendance is really important because we need to know if you're attended the session, and then um, yeah, and then it helps us as well. So, if there are no more questions, yeah, this is the last bit of our slides. So, we're describing the impact that key on of key requirements on services. So there are three impacts. That's effectiveness, experience, and safety. So the impact of all the key requirements, they can be significant um, on the health services in England, and they're far-reaching. So there are some examples like funding. You have regulatory requirements. You have the NICE guidelines. You have the Mental Health Act. You have the CQC or the Care Quality Commissioning, and you have it overall. So we'll talk about funding. So the NHS is funded through taxes and government funding. Okay, so any change in the funding levels, it can impact the availability and quality of healthcare services. Budget cuts can happen. Uh, so this leads to longer waiting times for appointments. So, for instance, if we had COVID-19, I give that example so much because that has given us so many um, examples to learn from. So because of that, there were a lot of budgets that were cut on, for instance, surgery, for urgent appointments. So they were focusing more on COVID-19. There were staff levels that were reduced because there was not enough funding to support the staff, or the staff wasn't well enough to come and support the patients. Fewer available resources for patients, obviously, because of the excessive need of healthcare during COVID-19, the pandemic. So, any change in the funding, any change in circumstances can change the funding, and then it can impact the effectiveness um, of the NHS working. Regulatory requirements, so regulations such as GDPR, where your data is protected, and Health and Safety Act at Work, um, uh, Health and Safety at Work Act 1974. They place legal obligations on healthcare providers. Compliance with these requirements can be time consuming, and they can be costly for health organizations. If you fail to comply, you can be shut down. There could be legal action against you or fines against you. Then you have the NICE guidelines that provide evidence-based recommendations, and these are on the prevention, diagnosis, and treatment of almost all of the medical conditions that we have out there. Healthcare providers, they're expected to follow these guidelines, and this is to provide high quality care. If you fail to do this, there are again regulatory bodies, and this makes funding being reduced and towards your healthcare system or where you're providing care. Then the Mental Health Act 1983, this provides a legal framework for treatment and care of people who have mental health conditions. It has significant impacts on patients and their families and healthcare providers. So it allows for involuntary detention. So sometimes you have to detain a person, um, and you have to provide them with treatment in certain circumstances. And this can be controversial and challenging for healthcare professionals as well, because it is out of the normal that you have to do things sometimes. Care quality commissioning. So it is an independent regulator of healthcare services in England. It assesses and rates the quality of care that is provided by healthcare organizations. When you have a poor rating, this can lead to reduced funding, negative media coverage, and loss of public trust. And the last is that the key requirements have significant impact on healthcare services. They can shape whatever services are being provided to the patients, as well as regulatory and financial environment in which the healthcare providers operate. So these are some of the references. Please have a look at them. They've been shared with you on your Moodle page as well. Um, Again, please look at the Health and Care Act, the 6 key questions. If you have any questions, queries, kindly email on learnerwork@ukversity.co.uk. That's learnerwork@ukversity.co.uk, and your submissions will be uh, on the same email. Okay, so assignment submission is after 2 weeks of the completion of the units and its delivery. So we still have time. So that's about it from my side. Um, Again, please have a look at, I'm sharing the link again with you in the chat. Please have a look at this video, and we will discuss it tomorrow, same time. So uh, I'll just stop recording and stop sharing. Any questions?